BSI, scene safety. I'm going to start with my scene size up, pen bands, personal patient safety, environmental hazards, number of patients, MOI, NOI, additional resources, need for extrication, and specialized equipment. I'm going to form my general impression, good, fair, poor, establish the patient report, get their chief complaint, and assess their mental status, alert, verbal, painful, unresponsive. Then I'm going to move on to my primary assessment, starting with the ABCs. For airway, I'm going to assess if it's patent or obstructed. I'm going to consider head tilt, chin lift, jaw thrust, MP, OP, and suctioning. For breathing, I'm going to assess the respirations, rate, rhythm, quality, and depth, rapid chest auscultation, and pulse ox. I'm going to consider supplemental oxygen via nasal cannula, non-rebreather, BBM, or pocket face mask. And then I'm going to move on to my circulation and assess the pulse, rate, rhythm, and quality, obvious external bleeding, cap refill, and skins, color, temperature, moisture. I'm going to consider shock position, AED, or cardiac monitor if paramedics are present. Then I'm going to observe for any deformities or disabilities, neurological deficits, facial droop or one-sided weakness, abnormal body positioning, blood glucose level, and determine my transport options, level of transport, ALS, BLS, mode of transport, ambulance or helicopter, and destination. And then I'm going to move on and get my sample, signs and symptoms, allergies, medications, pertinent past medical history, including age and weight, last oral intake, and events leading up to injury, as well as OPQRST, onset, provocation, quality, recurrence, region, radiation, severity, and time. I'm going to designate my vital signs and move on to my physical assessment, starting with the head, DCAT, BLSS, and tick, deformities, contusions, abrasions, penetrations and punctures, burns and bruises, lacerations, swelling, and scars, as well as tenderness, instability, and crepitus. I'm also going to assess for asymmetry of the head and face, drainage and cerebral spinal fluid, coffee ground emesis, unequal pupils, raccoon eyes, battle signs, soot, cinched nasal hairs, and broken or loose teeth or dentures. Then I move on to the neck and cervical spine, DCAT, BLSS, and tick, as well as tags, tracks, tattoos, JVD, tracheal deviation, accessory muscle use, carotid pulses, subcutaneous emphysema, tracheostomies, and stomas. Moving down to the chest, DCAT, BLSS, and tick, as well as paradoxical movement, accessory muscle use, rapid chest auscultation, subcutaneous emphysema, internal cardiac defibrillators, and pacemakers. Moving down to the abdomen, DCAT, BLSS, and T, as well as Dr. Germ, distension, rigidity, guarding, ecmosis, rebound tenderness, pulsating masses. I'm also going to assess for pregnancy or complications of the pregnancy, subcutaneous emphysema, colostomy bags, medication pumps, and urostomy tubes, and suprapubic catheters. Moving down to the pelvis, DCAT, BLSS, and tick, as well as femoral pulses, incontinence, priapism, vaginal bleeding, urinary catheters, and drains. For the lower extremities, DCAT, BLSS, and tick, as well as tags, tracks, tattoos, CMSC, circulation, motor movement and function, sensation, cap refill, pedal pulses, IV catheters, and drains. And moving back up to the upper extremities, DCAT, BLSS, and tick, as well as tags, tracks, tattoos, brachial and radial pulses, CMFC, circulation, motor movement and function, sensation, cap refill, AV shunts or fistulas, and IV catheters. And then for the back, I'm going to assess for DCAT, BLSS, and tick, as well as tattoos, subcutaneous emphysema, sacral edema, posterior lung sounds, and decubitus ulcers. And then I'm going to reassess the primary assessment, the relevant portion of the secondary assessment, and the vital signs every 5 minutes for an unstable patient, every 15 for a stable patient, and I give my report to equal or higher authority. And then for this physical assessment, you're going to start at the head. You're going to palpate for any obvious deformities, check your gloves if there's any blood. And you're going to walk down the neck, checking for any step-offs, across the collarbone or the clavicle. You're going to karate chop down the chest, barrel hoop the ribs. Then you're going to palpate the abdomen and the 4 quadrants, upper, upper, lower, lower. Then you're going to press down on the hips, on the pelvis, and then in. And then move to the lower extremities, offset, offset. And then you're going to check pedal pulses, cap refill. Can you feel them?
Yes.
And can you move your toes for me? Okay. And then for the upper extremities, you can do the same. Offset. Offset. Check radial pulses. Cap refill. Can you feel that?
Yes.
Can you feel that? Can you wiggle your fingers for me? And then you're going to roll them onto their side towards you. At this point, your partner would be getting the backboard ready. You're You're going to walk down the spine, spread the cheeks, and then you're just going to check all the way down the backs of the legs.